I'd like to introduce our speaker, Joanne Son, who's a postdoctoral pharmacy resident here at the Valley Hospital. Welcome, Joanne.
Thank you for the introduction. My name is Joanne, and I will be presenting on cannabidiol, or also known as CBD. So cannabinoids are a class of chemical compounds that bind to the cannabinoid receptors in your brain. And there are many active compounds from the cannabis plant. And there's over 100 cannabinoids that have been identified. So CBD is a type of cannabinoid that is non-psychoactive, whereas where you compare it to tetrahydrocannabinol, or THC, this is a psychoactive cannabinoid that you could commonly find in marijuana. So both hemp and marijuana products come from the plant species called Cannabis sativa, and hemp is typically where you find where many CBD products originate from. And marijuana has a very high content of THC, which is the psychoactive component, and hemp has more CBD as compared to THC, which is non-psychoactive. Hemp is legal in all over the United States, whereas marijuana recently in New Jersey was passed for recreational use, but currently it's only legal for medicinal use. So there are many uses of hemp. Over 50,000 different uses of hemp exist in the world. Some common examples are the CBD products that we're going to be discussing later on in this presentation. Hemp is also used for making textiles and ropes, paper, clothing products, carpeting, and also insulation. So the use of hemp goes back all the way to 2727 BC, where the first recorded use of cannabis for medicinal purposes was recorded. And just in 2014 was when some states started to pass the legalization of CBD products. And 2018 was when the Farm Bill was signed into law, which I will discuss on the next slide. So the New Jersey Hemp Farming Act was enacted in August of 2019, and this was when they legalized and allowed hemp producers to grow and sell hemp products in New Jersey. The 2018 Farm Bill was an act that was legalized and allowed for the production and selling of hemp products in the United States. So here they removed the definition of hemp. They removed hemp from the definition of marijuana. And hemp products or CBD products has only one FDA-approved indication, and this is for the treatment of seizures associated with Lennox-Gastaut syndrome or Dravet syndrome in patients of 2 years of age and older, and this is available as a prescription medication. So currently, the FDA does not fully regulate the production or selling of CBD products. However, they have indicated that it is illegal to market CBD products by adding it to any food or drinks that are available or marketing as a dietary supplement. They do monitor for any unproven medical claims, so the companies are not allowed to falsely claim that CBD can be used for a certain indication, and they do have warnings of unsafe manufacturing practices in the production of CBD products. The World Health Organization, or WHO, have released a new statement that indicated that CBD does not really have abusive potential and that it doesn't really cause harm. And However, they have indicated that the use of CBD is not really justified, and they do not recommend it for medical use. CBD products come in various different types of formulations. Some examples are inhalation products, such as vaping, topical products, such as creams or ointments and oils, oral products, such as capsules or tinctures or oils, edibles, such as gummy bears, and they also have transdermal skin patches that are available in the market. The main difference between the different formulation types are the time to full effect. So oils and tinctures have the fastest time to effect of 20 to 40 minutes. Edibles take longer, up to 2 hours, and patches take the longest, up to 5 hours. Inhalations do have an instant onset and are the fastest type. So although there are not many scientific studies that have studied the benefits of CBD, some possible benefits are that it could help with anxiety. For pain, it's been thought that CBD has some anti-inflammatory properties. And it's also believed to help with depression or cancer-related symptoms such as nausea. And CBD is now commonly available all over the United States. Some places that you could commonly find it are pharmacies, grocery stores. They now even sell it at the gas station or clothing stores. And there are also dispensaries that you can find CBD at. So if you are looking to take CBD products, you have to be wary of some of the possible side effects that are associated with it. So CBD can cause some sedation, and it's also been shown to decrease appetite. It could cause diarrhea, allergic skin reactions such as rash, and also, even though it's used for anxiety and for helping with sleep, some people have indicated that they had trouble sleeping on CBD and that it increased anxiety symptoms. There are some warnings that you should be aware of with CBD. For example, it could cause reproductive toxicity or fertility issues, and use with alcohol can increase the risk of drowsiness. So alcohol and CBD products shouldn't really be used together. And it could also affect many of the drugs that you are commonly taking at home. And it could also affect the liver because it is digested through the liver. So you have to be very careful when choosing a CBD product because many times there are inaccuracies in the labeling. And studies have shown that around 70% of the products in the market now are either over or under labeled. So some of them may contain higher levels of THC than indicated. They could have some synthetic cannabinoids. And some products have also been shown to even have pesticides or heavy metals in them. So when you choose a product with CBD, you want to try to go for the higher quality, the ones that indicate that they've been scientifically vetted, or if they have a certificate of analysis on their website, that's a good sign. And always avoid any CBD products that make health claims because they are not allowed to do this. So I'm just going to differentiate common labeling terms that you may see on CBD products. So hemp extract refers to CBD. Hemp seed is made from the seeds itself and does not contain any CBD product. Hemp oil also does not have any CBD, and hemp stalks may also contain phytocannabinoids, and phytocannabinoids do contain some CBD. CBDA does refer to cannabinoids as well, but the amount of cannabinoids is unknown currently. So the American College of Obstetricians and Gynecologists recommend that anyone who is pregnant or breastfeeding should avoid marijuana and CBD products. This is because CBD can cross through the placenta and also into the breast milk. CBD has been associated with lower birth weights, preterm deliveries, stillbirths, and it can also affect the fetal brain development. So CBD is metabolized by an enzyme in your liver called CYP. And there are many drug interactions between CBD and other drugs that you may be taking at home, because many drugs will inhibit or increase the amount of CYP in your body. So therefore, drugs may increase or decrease CBD concentrations, whereas CBD can also increase or decrease other medications in your body as well. One common example of a drug interaction is that CBD can increase Coumadin or warfarin levels in your body, and this can lead to increased risk of bleeding. So some common drugs that may interact with CBD are carbamazepine, phenytoin, allopurinol, nifedipine, verapamil, clopidogrel, and Nexium. And many people have had questions on whether CBD will have any effect on drug testing that you may have to undergo for work or other purposes. And the urine screens test for THC, which is commonly seen in marijuana products. So high quality hemp-based products that I mentioned are unlikely to test positive for THC. However, taking really high doses of hemp products or CBD products could possibly result in a positive urine screen. So since the FDA has indicated that CBD infused foods and drinks are considered illegal, it's best to avoid these products. However, the use of these products have been increasing in popularity lately. And when possible, it is best to avoid any CBD infused foods or drinks. So in summary, CBD products are legal in the United States, and they are widely available and commonly used for anxiety or pain and depression. However, CBD is associated with many side effects that I've mentioned before. Therefore, products should be chosen very cautiously. And since CBD is metabolized by your liver, it could interact with many of your medications that you're taking. So it's best to always consult a pharmacist or your physician prior to starting on CBD to ensure that your medications that you're taking do not interact. I can answer any questions that you may have for me now.
Okay, Joanne, thank you so much for a very informative presentation. We do have a few questions. Someone is asking, what is the best peer-reviewed study of the potential benefits of CBD products?
I don't have a specific study that's readily available for you, but however, I can tell you that there are not many peer-reviewed studies for the benefits of CBD currently. So the benefits are still a little unknown.
Okay, great. Another question, can CBD cream be used topically for muscle aches?
So CBD cream is a formulation that is available for topical use. And if you wish to use this for pain or muscle aches, you may try it. The benefits are still unclear. However, this is a reason why people do use topical products.
Okay, the next question. Is the CBD from the hemp plant superior to the full spectrum CBD from the marijuana plant?
So to clarify, CBD products that I've been referring to throughout this presentation are from the hemp plant. So since hemp has higher amounts of CBD, that's where CBD products are made from. Typically, you won't see CBD products being made from marijuana because marijuana has higher amounts of THC, which is the psychoactive ingredient, and that's what you're trying to avoid when using CBD.
Okay, next question. If CBD is listed as hemp-derived CBD isolate 10 milligrams, can one tell from what part of the hemp it is derived from?
If you're referring to a specific product that you have at home, all hemp is from the same plant that I've indicated before. I'm not sure exactly if there's a specific part of the plant that you're referring to, but if there's any like further details that you're looking for, it should say on the product itself or the bottle itself.
Okay, thank you. Another question. What are the common names of drugs that do interact with CBD?
So I did have a slide. I just mentioned a couple here. So carbamazepine, phenytoin, allopurinol, nifedipine, verapamil, clopidogrel, and Nexium are some examples. However, there's so many medications and drugs that are metabolized by your liver that can have an interaction. So if you have a specific drug or medication in mind, it's always best to just talk to your pharmacist about it and the possibility of there being an interaction.
Next question. How do you know how much to take?
So there haven't really been studies on exactly how to dose the medication or CBD in general. So I can't give you a dose recommendation. However, many products do have instructions on them on how to take the product safely. So I would refer to the package bottle itself and see what instructions that they have for you to take.
Okay, next question. Have there been any studies to prove that they work in pain relief?
So there has been some smaller studies. However, most of them were not peer reviewed when I did research on this. So it's hard for healthcare providers to recommend CBD use for pain relief. However, there are some smaller studies that have been conducted that have shown that for there to be some anti-inflammatory effects and to have some positive effects on your pain.
Okay, thank you. How do I know it's a high quality CBD product?
So I had a slide here. I will go back to it. A lot of times you want to avoid going to a place like the gas station to get your CBD products. Typically, your local pharmacy most likely will have your local pharmacy will have, I'm going to just tip them out, more high quality products than where you would find at your local gas station. However, there are a lot of products that say that there's a certificate of analysis, and this shows exactly how much of CBD they have and the quality of the CBD they have. So I would typically want to look for products that do have a certificate of analysis and indicate on their labels that it has been scientifically vetted.
Okay, great. Joanne, someone wants to ask about side effects. If you can go back to the side effects slide.
Mm-hmm. So if you see here on the slide, CBD can cause increased sedation, decreased appetite, diarrhea, skin reactions such as a rash. It can also affect your sleep. So some people have indicated that they are having more trouble sleeping. And it can also increase your anxiety symptoms as well.
Okay, Joanne, do people use it for digestive issues?
I mean, a lot of people try to use CBD for various different reasonings. However, a lot of the scientists, there's not a lot of scientific proof on whether or not it helps. I haven't really read a lot of information on CBD being beneficial for digestive issues, but I wouldn't doubt that people do use it to try to help with digestive issues.
Okay. And can you recommend a high quality company for CBD oils?
I don't know any. Personally, I can't recommend a specific company to you, but I would just recommend like going to your local pharmacy to find a higher quality product.
Okay, good. And do topical lotions with CBD have the same concerns with the drug interactions?
So topical products, the drug interactions are more towards if you take it orally. So topical products typically won't really have as many drug interactions.
Okay. If used for post-chemo neuropathy, will it have to be continued indefinitely, permanently?
I would ask your physician about how long you should be continuing that for and whether or not you should actually be using it for post-chemo neuropathy. I think your physician would have better knowledge about your specifics and more information about you in specific. So I can't really answer that in particular.
Okay, is CBD an anti-inflammatory or does it just fool the brain not to feel the pain?
So it will have effect on the receptors in your brain, but there has been some smaller studies that indicate that CBD works as an anti-inflammatory. I can't say this with confidence because again, these aren't peer-reviewed studies, and I personally wouldn't recommend it for anti-inflammatory properties. There are other medications that you could use for that.
Okay. Let's see, one more question I think we have. I have seen CBD oil for specific uses, such as sleep, anxiety, weight loss, inflammation, etc. Is there really a difference in the marketed types of CBD oil?
So if your product markets a specific type, if it's being marketed for a specific reason, I would say to avoid that specific product because they're not allowed to be making these claims at all. Typically, higher quality products will not make these claims because there are really not enough data to show that CBD can be used for these indications.
Okay, let's do a couple more. Are all ways of ingesting CBD processed through the liver, oil versus topical?
Yes, so all ingested CBD products will be digested by the liver.
And then does CBD affect levothyroxine dosage?
For if so, Synthroid, I will have, if you, is there a way to like get contact information for the questions, or sorry?
Yeah, whoever asked this question, if you could stay on the line after this call is finished, and we'll get your phone number. We'll have the pharmacist get in touch with you, okay? So just stay on the call, and then we'll get your information at the end. Okay, and where can one get resources to learn more about this topic?
So the FDA is a good resource. They actually have a section on it on their website, and on what, like, warnings on things to avoid in regards to CBD. So that's a good resource that I would refer to. That's reliable.
Okay, great. Well, thank you so much, Joanne, for your informative presentation.